Welcome to week 38. Can you believe it? We only have a couple weeks to go before the baby is due. This week, your baby is the size of a cabbage, a large cabbage. Already 6.6 pounds and about 19 inches from head to toe. So almost everything is completely developed in your baby, but your baby's lungs and brain are going to continue to grow until after birth. Your baby's eyes will most likely be blue when they're born, and then will change to gray, green, brown, whatever color. And if your baby's eyes come out brown, they're likely to stay brown. Your baby's lungs are still developing surfactant, which when they move through the birth canal, it will be squeezed out and it will help them to expand their lungs and take their first breath when they are born. So passing through the birth canal does several important things. Now, I'm not knocking C-sections. Sometimes they are necessary, but if they are not necessary, vaginal birth is so good for the baby because it helps the baby get grounded. It helps the baby get to the microbiome from that area of the mother, and it also helps the baby to be squeezed through and push out some of the fluid and things in their lungs and help jumpstart the surfactant. What is surfactant? It helps to keep the tiny little air sacs inside of their lungs from sticking together so that they can expand and contract easily, and it promotes an exchange of oxygen. Mom, your pregnancy journey is almost over. It's not uncommon for pregnant moms to go into labor this week, and you may be one of them. If not, hang on for the ride because you may have 3 or 4 more weeks left. Your breasts are likely becoming more tender again. You may be leaking some colostrum. Some people like to collect that. Others don't worry about it. I don't bother pumping or anything before my babies are born, but if you want to do that, it's now safe for your baby because sometimes pumping can induce labor. You may notice an increase in vaginal discharge. That's normal. If you start noticing really thick mucusy or pink tinge, then you're likely losing your mucus plug, which is a sign that labor could start soon. Not always, it can regenerate, but for me, every time I've lost my mucus plug, it's been about 24 hours or less that I go into labor. You may have a lot of questions about postpartum care. What do I do if baby has XYZ? What do I do for my body if I tear, if I have hemorrhoids, if I have any other common pregnancy ailments? Don't worry, I got you covered. Check out chapter 9.